think what these findings really emphasise is that school social environments matter for mental health, and we know that really matters for student learning. Promoting school connectedness might be a good prevention target for depression and anxiety.
The inclusive anti-bullying and harassment policies and the inclusive curriculum probably need to happen first in order to indicate that the school promotes and supports and implements this culture of, promoting, accepting diversity and inclusion.
Welcome Whatever Works, School Connectedness. Introducing our speakers, Monika Raniti and Gemma Lewis.
I'm Dr. Monika Raniti, and I'm joining you today from the land of the Boonwurrung people in Melbourne, Australia. So I'm a research fellow at the Centre for Adolescent Health at the Murdoch Children's Research Institute.
My name is Dr. Gemma Lewis, and I'm a psychiatric epidemiologist at the UCL Division of Psychiatry.
What is school connectedness?
In terms of school connectedness, it's a really broad definition. If I could put it into a nutshell, it really reflects the quality of engagement that students have with their school environment, their relationships within the school, so with their peers, with their teachers, and also their learning experiences. So it really relates to things like thoughts and feelings. So things like whether you feel supported by your teachers, whether you feel like you belong at school, whether you feel like you are motivated to learn or enjoy class. And it can also relate to behaviour. So whether you participate in fun activities at school or how much effort you put into schoolwork. So it has these multiple components, and in the research literature, it also goes by other names like school belonging or sense of school membership. So it can get a little messy in terms of definitions, which has some implications later when I talk about the findings of our review.
Can school connectedness help prevent anxiety and depression?
So we really were thinking about schools, as I mentioned before, as these social environments that we really need to capitalise on if we really want to promote good mental health and prevent depression and anxiety in young people. And so within that background, that's why we're keen to look at the role of school connectedness, because there's been some cross-sectional evidence that school connectedness is associated with less depression and anxiety and suicidal thoughts and behaviours in young people. But there's been no synthesis to look at the extent to which school connectedness might predict depression and anxiety later. So that's what we were really interested in. So we did a systematic review. We looked at prospective studies and intervention studies. And with the intervention studies, we were really interested in those interventions that were really targeting the school social and emotional environment. So thinking about improving relationships within the school or how psychologically safe students feel in the school. So in terms of our findings, we found about 3,500 articles in our search, and that ultimately led to 34 longitudinal studies meeting our inclusion criteria and 2 intervention studies. So that's what we included in the review. Most of these studies measured depression, not anxiety. We found a few looking at anxiety. But we weren't able to perform a meta-analysis due to some of those issues with measurement of school connectedness and variation in definition, and also because of the range of analyses that were done in the studies, we couldn't compare effects across the studies. So I just say that to highlight that we weren't able to determine the strength of the effects, but I'll talk a little bit about what we found now. If we think about all of the relationships that we found and looking at the overall pattern of those results, most of the studies, including the 2 intervention studies, found a significant protective relationship for school connectedness on depression and anxiety symptoms later. In our longitudinal studies, we found that effects were evident for up to about 5 years on average, which was quite impressive. And in the 2 intervention studies, we found effects about 1.5 years post-intervention. We also found a few studies that found a non-significant relationship, and we think that may be because of those issues with measurement again. I say issues, differences with measurement. We Also looked at whether improving school connectedness would promote remission in young people who are already experiencing depression and anxiety, but we didn't find evidence to be able to draw any conclusions on that question. Overall, studies were pretty good quality, but quite a few didn't control for key confounders like baseline depressive and anxiety symptoms. So just flagging that, causal inferences, we need to be careful about making them. And that because we couldn't do a meta-analysis, we couldn't look at risk of bias in the studies, publication bias, I should say. So we might be overstating some of the protective effects.
I think this idea of school connectedness is really, really important. What I really like about it is that it's focusing on changing the environment rather than a lot of other interventions we've tried in schools have sort of focused on the young people making changes themselves. So the young people making changes to how they think or how they process the environment, some CBT, some mindfulness. What I really like about this approach by Monika and team is that they're focusing on the wider environment and ways that we could shift or change that without having to rely on the young people understanding their mental health or learning this strategy and that strategy, which has its place. But when you're trying to prevent mental health problems in the general population, teaching adolescents about, cognitive strategies and stuff like that, I think is proved very difficult. And the evidence that that kind of approach is effective is actually very limited. So I think, this is really convincing evidence. Presumably what those studies also show is a sort of roadmap for how schools might design and create these interventions. So I suppose if I was working in a school, my question would be, okay, this is great. How can we go about actually modifying school connectedness to improve it? And if these intervention studies are out there, then I think that's a great starting point for helping schools to actually implement changes. Just links in with my project, which focused on universal interventions. So universal interventions are those that target everybody in a population, but also a whole school intervention is a type of universal intervention. And what that adds is that it involves multiple components of the school. So you're involving the young people, the teachers, maybe even the community, maybe charities, and you're coming at it from multiple levels as well, which I also think is a really, really valuable approach.
I think what these findings really emphasise is that school social environments matter for mental health, and we know that really matters for student learning. Schools that foster school connectedness, especially through supportive relationships between all members of the school community, so not just between peers, but between teachers and peers, between students and other members of the school community, might be a really good way, or is a really good way to promote mental health. And with more research, promoting school connectedness might be a good prevention target for depression and anxiety.
What further research is needed on school connectedness?
We need more studies in places other than high-income countries. Most of the studies we found were from the United States, so we do need a broader scope of where these studies are conducted. We also need better design studies that look at the benefits of school connectedness over a longer period of time, because it might be that the way you connect with your school actually changes as you get older, or changes with development as different periods of time are perhaps more sensitive for the development of mental disorder. And we might also look in the future at whether some of these benefits extend to other disorders outside of depression and anxiety. So overall, we've got a little bit more research to do, but on reflection, I think school connectedness is this really attractive active ingredient because you're focusing on changing relationships within an education system that governments already make substantial investments in. So it's really a win-win, I think, for the education and health sectors. Because what we've found in some of our other research and that others have done is that if you don't have intersectional collaboration between health and education, it's really difficult to make some of these sustained policy changes and sustain some of these whole school approaches to intervention. So I think school connectedness is quite appealing to stakeholders in both sectors in that way.
How can schools support the mental health of LGBTQ plus youth.
We wanted to focus on universal interventions that improve the school climate, culture, and ethos, specifically for young people who are sexual minorities or trans young people. We classified the interventions that we found into 5 themes. The first one was gay-straight alliances or similar student clubs such as pride clubs. So these are clubs that exist in a school. They're student-led, but they also involve lots of other members of the community, and they have lots of different roles. And they're very flexible and responsive. But the idea is that they'll provide a safe space for sexual minority and trans students. They will also involve support from allies, which include other students and also teachers. They'll also engage in activism within the school, and they will work together to promote a more inclusive and accepting environment. The second kind of intervention that we found was inclusive anti-bullying and harassment policies. And these are school-wide policies which are designed to provide a positive culture, ethos, and environment for diverse young people. And what we found was that these policies are great and they work, but as long as they're explicitly inclusive for sexual minority and trans young people. We also found evidence for inclusive curriculum. And this was one that the young people we worked with really, really liked. So these were things such as teaching resources, books. There was one really nice example, which the young people who we worked with loved, which was a quality study which spoke about a librarian in a school in the States who put little stickers on all of the books in the library that told stories about sexual minorities or trans young people and included sexual minority or trans characters. And I think not only does that increase representation and visibility, but it also signals, from the librarian and therefore the school, that there's a supportive environment in place within that school. The fourth type of intervention was sort of one-off workshops. So these are universal in that they are aimed at and include the whole school, or the whole school can attend, but it's a one-off workshop. So an example might be a sort of media-based intervention. So there was a Canadian study which used an intervention called Out in Schools, and it assembled a panel, showed a film, had a panel discussion, involved students and teachers, and stuff like that. So again, sort of fostering understanding, compassion, empathy, and education, but doing that in a one-off workshop. And what emerged from our discussions with the young people who worked with us was that stuff is great, but it needs to be part of a wider, longer-term strategy that is consistent and isn't tokenistic. So another thing that the young people commented on was, for example, very often schools will be reactive to Pride Month, and they'll put up flags and posters and banners and stuff, but as soon as Pride Month is over, that will disappear. And one of the things that is really important is incorporating that into a wider, consistent, longer term, meaningful strategy that is always in place, basically. And the last type of intervention, which emerged as really important, but I think cuts across the other 4, was staff training. And that really links into the next bit, which was about mechanisms. So the method that we use sort of asked us to think about the mechanisms that might underlie the effectiveness of these interventions. And we drew these mechanisms from qualitative studies or from the discussion sections of papers, and also through our conversations with young people, and also with teachers and policymakers, and also a school governor. And what we concluded was that these interventions seem to work best when teaching staff and school leaders are properly trained and they understand the inclusive curriculum, they're trained in it, they know what terminology to use, they know how to implement it. And the same with the anti-bullying and harassment strategies. The teachers have to be aware of them. There was one study which found a really surprising result, which was that a higher than expected proportion of schools have these policies, but the teachers don't actually know about them. So if the teachers don't know about them, they can't implement them and they can't work on them. So the staff need to be aware and they need to be trained. There are multiple levels to this, which I think we need to think about. So I think that the inclusive anti-bullying and harassment policies and the inclusive curriculum probably need to happen first in order to indicate that the school promotes and supports and implements this culture of promoting, accepting diversity and inclusion. And then the school needs to sort of support the gay straight alliances and the pride clubs, which could perhaps then follow. And it's really, really important that all of the staff are trained and engaged in this process.
What I really liked about the way you conceptualized the project was really thinking about schools as whole school environments. So, in our project, we looked at the social and emotional environment, but you've really extended it to looking at the supporting policies, the training that's required of school staff and teachers to really support a lot of these initiatives in schools and really make sure that they're embedded and sustainable over time. And I think that that's a conceptualization that we don't always see in the intervention literature. And so, I think that that's really, really positive. And the other thing that I was really interested to hear was this idea of, potential risk and harms. And again, I think that's something that we really need to deeply consider when we think about some of these interventions and really thinking about the mechanisms and contexts in which we're working to make sure that we're not inadvertently causing harm. And I know that there's some bullying intervention literature that has suggested that there is harm that can be caused in some context for some students. And so I think that's really important to highlight. So Gemma, you mentioned that where we need to start is thinking about the curriculum and some of the clubs and things like that, but before moving on to teacher training. And I just wondered, if we're thinking about some school environments that perhaps are a bit more risky for using some of these approaches, I'm wondering what your thoughts are around sort of pre-service teacher training and investing in training and teacher capacity building prior to doing some of these interventions in schools in order to try and foster an environment where these interventions are more likely to be successful. Do you have any thoughts on sort of the chicken or the egg scenario there?
A fantastic question. And it did come up in one or two studies that teachers wanted this kind of thing to be included in their training. So before they even got to schools, because although it's true, I think what you said, Monika, that there's been a neglect of sexual minority, but particularly trans students within schools, I think that, inclusivity and diversity has really been pushed up the agenda in recent years, thankfully. And I think teachers in many countries are aware of that, and they would really welcome training on appropriate language and responses and approaches and inclusive curricula and policy before they actually get into schools. So I think, that's a really, really good point. And I think, it was raised by the young people as well.
How is school connectedness linked to youth mental health?
So this is a tricky one because we actually didn't identify any longitudinal studies that examined how school connectedness is linked to later depression and anxiety, which is telling in and of itself. I think it is a really important area for future research. In the intervention studies I mentioned, so one from the USA and one from India, we found that they increased school connectedness and this led to improvements in depressive symptoms. And so the one from the USA found that this was occurring through improvements in self-esteem. And in the study from India, that one found that the improvements to depression were occurring specifically through improved relationships within the school, so the quality of those relationships. So remembering with school connectedness connectedness being this multifaceted construct, it seemed like the relationships aspect was quite powerful in that intervention study. And so I guess these are two pieces of evidence that we can draw upon. But because we didn't find a lot of information, we actually explored this in a lot of detail with our youth advisors, who were really valuable in helping us to kind of think through, well, what's going on in this relationship. And so our youth advisors raised a few mechanisms that might be worth pursuing in future research. So they definitely agreed that relationship quality is a big one. So not just thinking about their relationships with their friends, and not just thinking about quantity, but actual quality of those relationships. How supported do you feel? How much do you feel like you can go and talk to somebody when something's bothering you? How much do you feel like that's somebody you can trust? And the same with teachers in the school, and also other school staff. So that could be, the bus driver, or it could be a sports coach, it could be a music teacher, it could be, in some schools they have security guards. They spoke about this idea that it's all individuals in the school, people in the canteen, feeling like these are people that you can trust, and maybe you have a relationship that you build over time. How motivated you're feeling on a particular day might impact that relationship. How lonely you tend to feel. So I've recently become aware of other literature that starts to suggest that how lonely you feel subjectively might actually impact how socially connected you feel. So if you desire to be more socially connected and you're not, that could increase feelings of loneliness. Whereas if you don't desire to be as connected, then that might not impact your feelings of loneliness. So there might be something there around loneliness. Youth advisors also mentioned your sense of purpose, so why you go to school and how it links to your wider aims in life. And what I found really interesting were these other two potential mechanisms. So academic pressure, so how stressed you feel by the academic expectations of your school, and also social expectations of behaviour at school. So, for example, having to wear a uniform that conforms to a particular gender stereotype. Our youth advisors actually raised that sometimes higher levels of school connectedness lead to worse feelings of depression and anxiety. And these were the mechanisms through which they proposed it happened. So if you're feeling really connected to school, it might be that you actually experience that academic pressure more greatly. You really want to please your teachers. You're really connected with students. You don't want to let anybody down. You really feel pride in your school. And it's actually that stress and pressure and worry about what other people are thinking that might contribute to higher levels of anxiety. And so even though we didn't really find evidence to support this in the empirical literature, I do think it's something worth exploring further, especially if we're using this information about mechanisms to inform our intervention design, and really thinking about, as you were saying, Gemma, potential risks or harm for students, or even just thinking about how to target these interventions most effectively.
Our mechanisms really are all about reducing discrimination and stigma in order to improve inclusivity, acceptance, and positivity about sexual minorities and trans young people. So, to speak more specifically, the mechanisms are really about reducing homophobic, biphobic, and transphobic bullying and discrimination, and also reducing feelings of unsafety, but also exclusion. And I think the exclusion point speaks to the importance of two things, which are visibility and also normalization. And I think these are the two sort of major things, and which were really supported by our young people. So visibility of role models within the school, within the curriculum, broader historical figures, not just remaining in what we would refer to as this cis-normative or heteronormative stance. It's really about, talking about diversity and really making it visible and normal. Those two things were regarded as really, really important, and the mechanisms by which feelings of exclusion and marginalisation are reduced.
How else can schools ensure that everyone feels included?
We know that young people who are healthy and mentally healthy have better education outcomes, and we know that students who are engaged in learning and complete school have better mental health outcomes and health outcomes in the future. So we know that education is this really key social determinant of health. And I think as a broader prevention strategy, when we're thinking about primary prevention, so prevention of disorder before it begins, we really need to start looking beyond trying to translate treatment approaches, so CBT, interpersonal therapies, into potential prevention strategies. It's not to say that treatments are not important and that we need to invest in understanding the best treatments in the right context for the right people, but we need to think more broadly. And so thinking about social determinants like poverty, like employment, like discrimination, all of these social determinants that are intimately related to the school setting. You know, in thinking about partnering with families and parents and ensuring students have access to schooling, have access to breakfast to help with their learning, feel like they can come to school and feel safe and included and not discriminated against. Schools are these settings where all of those social determinants play out. And so I think taking that broad perspective is important in society, and schools are a key part of society for young people.
I suppose the other thing I'd add, which was sort of surprising to me, but actually seems obvious when you think about it, is that the young people I've worked with during my research have really, really loved the idea of a universal intervention. And the reason for that is that, when young people are in school, they don't want to be singled out. So these universal interventions, which include everybody, and they don't sort of, I really strongly agree with what Monika said about moving away from using treatment approaches for prevention. So I think there's a place for these school-based interventions that, will take sort of young people experiencing symptoms already, to some sort of low-level CBT. There might be a place for that, but also young people are really, really interested in these universal interventions which don't single them out and, can reach and help everybody without people being singled out. So I think that's, and yeah, just the only thing I would add, basically, and just really emphasising the importance of this multi-level, multi-component whole school approach.
Visit the Wellcome website to find out more about mental health at the Wellcome Trust.